So here on the right of the screen is what you will see if you ever use the CATS tool. Like I've been mentioning, it's fairly simple. The 6 categories are divided into 6 categories on the far left-hand side. In the middle, it explains the independence, what it would look like for each category, and then to the right of that column is what dependence might look like for each of those categories. So when scoring the CATS index, again, you're scoring for independence. So in any 6 of these columns, if the client or patient was to show as independent, you would give them 1 point for each of the 6 categories, and if they were dependent or were not independent, they would score 0. This would eventually reveal a score anywhere from 6 being the highest, 0 being the lowest. Full function would show as a 6, moderate function anywhere around a 4, and severe function a 2 or less. Now, any healthcare provider can administer the CATS index. It's necessary if you want this process to be a little quicker to understand the client and their form of function. And depending on how well you know the client and their function will impact how long the initial assessment takes. The recommendation for this assessment is to take place over at least a 2-week period of observation, and that will allow you to establish a sort of baseline with your client and then see where they go from there, whether they maybe begin to perform better in some areas of ADLs or they decrease function depending on what type of intervention you apply. The CATS index was developed in 1963, and it was originally developed as a geriatric assessment by gerontologists. So its original population that it was meant to assist with was older adults in numerous care settings. These settings today range from nursing homes, hospital settings, that can be either acute rehabilitation or long-term care settings, adult day health centers, as well as home care. Because this tool is so simple, it is really useful in creating a common language between patient and client, and it allows for appropriate planning for discharge, determining which intervention will be used, and in predicting lengths of hospitalization. When talking about the tool's clinical utility, it is important to keep this simplicity in mind that I continuously mention. Because it is so simple, that also makes it a fairly broad tool. This limits its ability to measure small increments in functional change. Because of the tool's ability to generalize, there's also limited data out there available supporting its reliability and validity. But reports in much of the literature states that it has high convergent validity, and it also does measure what it is measuring, or meant to be measuring. A quick example of this is, in one study, patients who scored independent had shorter hospitalizations and were discharged earlier and more often than the other patients in the study that were reported as dependent, according to the CATS index. Though the data is limited regarding validity, it is out there.